is up, Smashers? It is another awesome day. Guess where I'm hanging out today? CSA. Look who we got in the background. Swole Joel. Don't worry, I'll tag him in the video because otherwise he will freak out. Isn't he gotten bigger? Look at him. He's a monster. He's the monster. He's going into the power room. He wants to throw a little shot. He's gonna do something. There he is. All right, so we're gonna be talking about scapular mobility. And you know how important is the scapula? Well, it pretty much controls everything with the shoulder. Remember what I said? Scapula is the shoulder and shoulder is the scapula. And right now I'm yapping in the background of somebody's workout right over there. Sorry, I'm not messing it up, but I think she's okay with it. But talking about how the scapula moves, it needs to have 6 ranges of motion. I realize I'm holding up a 4, but it's because I'm holding it's like I'm a magician, right? Palming a lacrosse ball. So 6 ranges of motion. We have elevation, depression, rotation, clockwise and counterclockwise, and then protraction and retraction. All that affects how the shoulder moves, because if it dumps forward, what you're gonna wind up doing is grinding the anterior portion of that joint, chewing up that labrum like you just threw it into a meat grinder. And then the other part is we have the Pec Major and Pec Minor. We're gonna unglue both of those. So that Pec Major, let me grab a J-hook and I'll show you what I'm talking about. Got some good vibe here at CSA, by the way. Just good juju. It's Kieran Fitzgibbons, probably one of my dear friends, my close friends. He's a good dude, runs a really tight ship. So if you guys ever want to train somewhere, go hit CSA. It's a pretty legit place. So Pec Major anchors on that sternum, that right up through here, comes into the humerus, and then we have that Pec Minor sitting underneath, comes off ribs 2, 3, and 4, and then goes all the way into that coracoid. So what happens is when it gets short and tight, it starts to bring that shoulder up and over and kind of jam everything up in here. So if you don't get that freed up, you wind up getting these shoulders like this, and you get a lot of this internal rotation of the humerus, which hijacks all your overhead mobility, or if you look to my right, which you can't see, I won't do it, muscle ups. That's another thing that's gonna get affected with that. And then we come underneath that scapula, we have this this super funky muscle called the serratus anterior. Interdigitates, you gotta love that word, right? With the ribs, and loops underneath that scapula and keeps it against the rib cage. But the problem is when it's super short and tight, or when it's glued to the rib cage and it won't allow that, it's the boxer's muscle, right? It does that protraction. If it doesn't allow that scapula to slide around, you're gonna wind up with a lot of shoulder issues as well. So we're just gonna unglue all that stuff in like the easiest, most fun, funky way ever. So check this out. Yeah, I got my trusty handle. That's my camera stand, you guys know. So I'm gonna put the video down. Good. I still got the lacrosse ball because we are gonna use it. What you're gonna do is you're gonna grab a band, chuck the band. I'm gonna get a little wide so you can see what I'm doing. You're gonna put the band about shoulder height. You're gonna loop into the band. You're gonna grab behind you. So I'm grabbing behind myself like this, and we're gonna basically do what's called, we're gonna bring that arm all the way back up like this, right? So we're gonna extend that really, really far so we peel away that serratus anterior. And in doing that, we're gonna free up a lot of that scapula just by doing that. I gotta change this angle because it's driving me nuts. So we're just gonna dump it like this. So like I said, by freeing up that serratus anterior, you wind up freeing up the scapula, you free up the scapula, free up the shoulder. It's just that easy. So pull in real tight, pin the arm behind you. So grab it, you can see what I'm doing is I'm grabbing the arm behind me like this. I'm gonna bring the arm, I'm gonna step into it so it winds up dragging the arm up behind me. So I'm gonna pull from the side so you can see exactly what I'm doing. So I'm allowing this, so I have my arm here, I'm taking a knee, I'm pulling in, so it's pulling the elbow in towards my torso, and I'm gonna keep a nice, excuse me, it's the hantavirus that I'm carrying around. So I'm gonna let this peel this away, ungluing that serratus anterior. You give it a little pull for a second, and then let it drag you even higher, a little PNF if you need to. If you've got chest really tall, you're gonna hit that stretch a ton. That's number 1. Number 2, you've got the levator, comes off the top of the scapula and attaches on C1 to C4, right at the base of the skull and the top of the cervical spine. But it's gonna elevate, does exactly what it says. Elevates that scapula, jams up that shoulder even more. So we're gonna hit the trap and the levator and just kind of peel them apart. So you load up a barbell, tuck yourself underneath, make sure you got some weight on here, otherwise it's gonna go all over the place. Grab onto the side of the barbell, tuck in real hard, turn your head away, and just raise and lower. So this is almost like your own little personal active release technique. So that's number 2. That's gonna unglue all this stuff in here. And number 3, if I can find my lacrosse ball, super funky, is we're gonna peel away that pec. So check this out. Yeah, that's the lacrosse ball. So what happens is take the lacrosse ball, tack it up against the rig, door jamb, doesn't really matter what you're doing. I'm gonna go to this side just so you can see what I'm doing. I'll come down real low since apparently I'm chopping off the top of my head. It's like my video skills have just gone right to hell today. Tuck the lacrosse ball inside here so you can see where I am, tucked in on that Pec Major and that Pec Minor's underneath. So you wanna kind of capture both. Cinch up real tight, hold the lacrosse ball with the other hand. I really don't wanna do this one because it hurts. So I got the lacrosse ball in here, open up your palm, and just grind away, up and down, up and down. How long do we do this? Until you feel the change happen. Once you're done, you got a nice, super frosty, super spongy, super supplitude scapula, and your shoulder works the way it's supposed to. Hey, Trev, CSA, having an awesome day. Check you guys out tomorrow.